So you've probably heard that Luxembourg has one of Europe's best healthcare systems, but what actually makes it so special? Well, in this explainer, we're going to break down exactly how it all works, from who gets covered to what gets paid for, and why you have so much freedom as a patient. Let's dive right in. Let's just start with the headline number, shall we? On average, the state reimburses a massive 88% of your medical costs. I mean, that one figure alone tells you so much about how generous this system is really designed to be. And believe it or not, it actually gets even better. For some of the most important moments in life, the reimbursement is total. Yep, we're talking 100% coverage for all of your children's health care and any care related to maternity, from the first checkup to the delivery. But, high reimbursement is really only half the story. The other key benefit here is freedom and speed. Unlike a lot of other systems where you need a referral from a family doctor and then face these crazy long waits, here you get direct access. Need to see a specialist? You can often get an appointment in just a week. It's that combo of generous coverage and direct access that makes this system a real standout. Okay, so here's our game plan. We'll start with the basic rules. Then we'll look at who qualifies, what those reimbursement rates really mean in practice, what happens if you're too sick to work, and finally, we'll tackle the big question. Do you even need extra private insurance?
All right, first up, the basics. To really get a grip on how all this works, we need to look at the three core principles and the key organizations that are running the whole show.
The entire system is built on three simple but super powerful ideas. First, it's mandatory. If you work here, you're in. That keeps the system well-funded. Second, and this is huge, you have free choice. Need a dermatologist? Just book one. No referral needed. You're in the driver's seat. And third, prices are based on fixed tariffs set by the state, which means total transparency. You always know what a service costs. You're going to see three acronyms pop up all the time, so let's make them super simple. Think of the CCSS as your front door. They get you registered. The CNS is like your bank. They're the ones sending you your money back. And the CMSS? They're the specialists for more complex situations, like evaluating long-term sick leave.
Now, here's the best part. You barely have to do a thing. It's all pretty much automatic. When you start a new job, your employer handles that first step. The CCSS then gives you your social security number and hooks you up with the CNS. It's a totally seamless process designed to get you covered right from day one.
Okay, now this is a really important practical detail that you need to know. Unlike in some other systems, here you usually pay the full cost of a service up front. You then send the receipt to the CNS and they wire the reimbursement right into your bank account. It's a simple pay-then-reclaim model.
So now that we've got the basics down, let's move on. Who actually gets to be covered by this system?
The rule here is beautifully simple. If you work in Luxembourg, you are covered. And that coverage starts on day one. No waiting periods, nothing. The system is also incredibly family-friendly. You can easily add your spouse and your kids up to age 30 as co-insured members for free. It really ensures your whole family is protected.
The system is also really smart about Luxembourg's unique workforce. If you live and work here, it's pretty straightforward. But if you're a frontalier, that's a cross-border worker, you get this cool hybrid model. You're covered by Luxembourg's CNS, but you also keep your health rights in your home country. This gives you the awesome flexibility to get care in either place as long as you fill out the right form.
Okay, now for the part everyone really wants to know about, the money. What exactly does that 88% average reimbursement cover? And what about the specifics for different kinds of care? Let's get into it.
Let's just visualize a standard doctor's visit. See that huge purple slice? That's the 88% of the cost that the CNS covers. You're only responsible for that small little sliver, the other 12%. And don't forget, if this visit is for your child, the whole thing is purple. The reimbursement is 100%.
When it comes to medicine, it works on a pretty simple tiered system. The most essential, life-saving drugs are 100% covered, no question. Your standard medications, like paracetamol, get an 80% reimbursement. And even some comfort items, like certain vitamins, can get 40% back as long as you've got a prescription.
And that great coverage doesn't stop there. Basic dental care follows that standard 88% rule. But I think this is really smart. The system actually rewards you for being proactive. For major dental work, your reimbursement can climb all the way to 100% if you've been getting regular checkups. And if you have to go to the hospital, your out-of-pocket cost is just a small, fixed daily fee.
Okay, so beyond just paying your doctor bills, the system has this incredible safety net for when you're unwell and just can't work.
Now this, right here,
is probably one of the most powerful benefits of the entire system. If you're too sick to work, your full salary is protected at 100% starting from the very first day. Your employer covers it at first, and then the CNS takes over payments for up to 78 weeks. It's a safety net designed to let you focus on one thing and one thing only: getting better.
And that amazing support continues for new mothers. You get 20 weeks of fully paid maternity leave, again at 100% of your salary. And like we said before, this is on top of the 100% coverage for all the medical care for you and the baby. It's truly comprehensive.
So, with all this incredibly generous public coverage, you might be thinking, is there any reason at all to get a private, complementary health insurance plan? It's a really good question.
And that's really the question it comes down to, right? The state system is fantastic, but it's not designed to cover every single little thing. So, let's look at the specific gaps that a complementary plan is built to fill.
So a private plan, which they often call a mutuelle here, is designed to plug 3 specific gaps. First, it covers that little 12% slice of your medical bills. Second, it covers extra fees if the doctor charges more than the official state price. And third, it pays for comforts and alternative treatments the state doesn't cover, like a private hospital room or things like osteopathy and acupuncture.
All right, to wrap it all up, here's your quick checklist. Coverage is automatic when you start work. Reimbursements are super high, you have total freedom to choose your doctors, but remember, you usually have to pay first and get the money back later. And for that complete peace of mind, a pretty inexpensive complementary plan can cover those remaining gaps. And that's our breakdown of the Luxembourg healthcare system. So, the final question is really a personal one. Now that you know how this amazing public system works and what the small gaps are, what's the right level of coverage for you and your family?